Good evening. I'm Dr. Krupal, one of the duty doctors on duty. Can you tell me your name and age?
Yes, doctor. My name is Jennifer.
Yeah,
Eh, I'm 50-year-old.
okay. Thank you, Ms. Jennifer. Ms. Jennifer, as I can go through your notes, you are having a plaster cast for the fracture of right arm. Is that correct?
Yes, doctor, you are right.
Okay, Ms. Jennifer, how are you feeling today?
Doctor, still I'm having severe pain. I can't
Mhm,
able to move my arm, and I'm
mhm,
having asthma issue. So I don't know, like I'm on continuously taking medication, and this medicine makes me feeling very anxious, and really I
mhm,
can't do anything. Like I can't drive. I'm just
mhm,
using my arms immobile. I
mhm,
don't know
mhm.
what to do.
I'm sorry to hear that. Ms. Jennifer, I can really understand your situation as this cast is there since almost 4 to 5 weeks. But Ms. Jennifer, I am having your X-ray report also. Do you know about that?
Don't know, doctor.
Mm-hmm.
What's that, doctor? Is there any issue on my right?
Yes, Ms. Jennifer. Yeah, we have done the X-ray, and unfortunately, it shows that the bone has not still healed. The bone ends has not completely joined still. So we have to wait for some more time. Do you follow that, Ms. Jennifer?
Doctor, really, I feel very bad. Oh my God. Is there anything I need to do to heal very quickly?
There is, as such, nothing specific, but we have to investigate further and find out the cause behind non-healing of this fracture. So, Ms. Jennifer, may I know since how long you are suffering from asthma?
I have a long issue, like
Mhm.
nearly more than 10 years. I
Okay,
think so.
okay.
Yes.
Anybody else in your family has this?
No, not anyone, but
Mhm,
my mom had some bone issue.
mhm.
So that I'm not sure
Okay.
whether I can have that or not. And due to
Mhm,
this fracture, I'm in my home, like not going outside.
mhm, mhm. Okay, Ms. Jennifer, have you checked your vitamin D and calcium level? Anytime,
No,
like, have you
doctor,
checked it?
very long time before I
Yeah,
checked my vitamins.
yeah. So it was normal or it was low?
No, doctor, it's very long time, nearly a year before. I couldn't remember.
Mhm, mhm. So, given the condition, Miss Jennifer, I suspect that you are suffering from a condition called as osteoporosis. Okay,
Okay.
it's a medical terminology. Do you know about that?
Yes, I think my mom had this issue and she
Okay.
was taking medicine for vitamin D and calcium, something like that. I'm not
Mhm.
sure. Yes.
So, actually, in this condition, your bones become very weak, and the healing capacity also comes down, and the bone can break easily. So it's actually age-related condition. Also, it is related to intake of vitamins, especially vitamin D, and level of calcium in the body. Okay, if there is imbalance in between these three things, then patient can develop osteoporosis. Okay, did you follow that, Ms. Jennifer?
Yes, doctor, I understand. Could you please tell me any suggestion what kind of food I can take to improve my
Mhm.
vitamin D and calcium level, please?
Definitely, Ms. Jennifer. Uh, First of all, I would like to discuss regarding the diagnosis of osteoporosis. Is that okay with you? And then I will give
Okay,
about
doctor.
the diet advice.
Okay, what I want to do, doctor.
Yes. So first of all, we have to see the density of bone, like whether it is low or normal. So in osteoporosis, as I told, the density will come down, and there are two tests, mainly a simple X-ray test, and then followed by a DEXA scan that will detect the density in the bone. are you okay with those tests?
Yes, doctor, I'm ready to take maybe as
Okay.
much possible
Okay. Yeah.
I can
Thank
do.
you. So this DEXA scan is very simple test. Actually, it's kind of a modified X-ray, and it will be done in few minutes, and it will actually detect the density in bone, and also it will separate the bone tissue from the soft tissue like muscles. So we will get the report within few hours, and according to that report, we can suggest you what kind of treatment you should take, whether you will require uh, uh, any intravenous medication or only tablets are sufficient. We will decide according to the report. Is that okay with you, Ms. Jennifer?
Yes, doctor, but I'm not happy about X-ray because I'm afraid that
Mhm,
I can get any
mhm,
complications like cancer or something like that.
mhm.
I'm very
I
worried
want to
about it.
reassure you, Ms. Jennifer. This is one of the safest tests, and the risk of cancer is almost negligible. The amount of radiation you will receive in this test is not more than that of a 2 or 3 X-rays. So the chances of having any complication due to this test is completely very less. Like, and it's not a invasive test. It is just a diagnostic test, just like an X-ray. Uh, are you okay with that test, Ms. Jennifer?
Yes, doctor. Yes, doctor. I'm ready to take any test, doctor.
Okay, Ms. Jennifer, do you have any other concerns?
No, doctor. I'm happy about all your
Yeah.
questions,
So,
doctor.
Ms. Jennifer, to summarize our discussion, you are having a condition called as osteoporosis. That may be the reason behind non-healing of your right arm bone fracture. And we have to do a few of the tests to detect that. One of the main tests is DEXA scan, and which is a very simple test. Okay, we'll plan for
Okay,
that
doctor.
tomorrow.
Sure.
Till that
Thank you.
time, I will be giving you some of the leaflets. You can go through that, and you can read about osteoporosis as well as the diagnosis of osteoporosis by DEXA scan. Also, my clinic's address will be clinic's phone number is here. You can, if you have any doubt in future, then you can call and book an appointment and come and show.
Thanks, doctor. See you tomorrow.
Yeah, you're welcome. Thank you.
All right. The first and foremost thing is that you have exceeded the time. I think you have,
Yeah.
yeah, you have taken 6 minutes to complete the role play conversation, which is not good. The problem
Yeah.
is your summary was very long.
Mm-hmm.
Instead of telling all these things, what you could have done is you could have simply mentioned, say, for example, okay, to summarize what we have discussed, or to, you can simply say, to summarize, we have discussed the osteoporosis and their risks and causes and the ways to treat that. Would you like to know anything else? That's it, finished. Okay. All right. So don't give too much explanations if you are running out of time. All right. So that
Yes.
could have been
Yes.
done, which could have been cut down a bit. Right, that's one thing. But let me give you, the remarks on your speaking before we can go through. Okay, so you started
Yeah.
saying, can you tell me your name and age, isn't it? Does that sound
Mm-hmm.
informal? You could have added,
Uh,
please at the end.
yeah.
Okay, all right,
Yeah.
or
Yeah.
you could have said, may I know your name and age. That is also fine. So
Yes.
can you tell me your age and
Yes.
name and age, please? Okay, that could have been done. Otherwise, you can say, may I know your name and age. That is also good. Okay.
Yes.
Apart from that, the introduction was really good. So the introduction was great. Okay. Great introduction was performed. Okay. So I'm very happy with that. And then you have shown excellent sympathy towards the patient. Okay, it's really good. I'm very happy with the way that you have excelled in this area as well. Okay, and then the other thing is, there are several grammar mistakes you have committed. However, I'll
Yes.
give you the positive things first before we discuss those things. You were able to induce the patient to take part in, okay, sorry, you were able to induce the patient to take part in the role play. So it was good. I'm very happy with that. Also, your explanation was very great. Okay, your explanation was exceptional. You are able to define all the technical terms. You are able to provide the information using the connecting phrases. Connectivity is amazing. As I already mentioned, you are able to use all those connecting phrases, okay, and then get the information across, okay, to get your information across. All right, so that's good. I'm very happy with the way that you have done this one as well. All right, so these things are quite good. There are a few areas of improvement that you have to do. Okay, you have to manage your time. That is one of the major issues. All right, and then the other mistakes are related to grammar. I'll give you those things. Okay, you said there is as such, and then you said something else, you know, as such a complaint or so on. So that's wrong.
Yeah.
So you should have mentioned that there are no issues or something, you know, you could have mentioned, you know, some other sentences, but this one is wrong. Don't say, since how long have you been experiencing these issues? This is wrong. This is absolutely wrong. Okay, so what you should have done is, how long have you been experiencing? That's fine. How long have you been experiencing this issue? Don't say since how long or for how long. That's not needed. How long have you been means it asks the patient the duration of the problems, you know, that the patient has. Okay, so that's fine. And then you said anybody else has this issue. Anybody else in your family? Anybody else in your family has this issue? That's wrong, because where is the verb? Verb is not there at all, isn't it? Whether it is a question or a sentence, verb must be there. Okay, so what you should have done, okay, you should have mentioned, does anybody else in your family have this issue? All right, that's good. So you could have done this. Otherwise you can say, is there anybody in your family suffering from this problem or experiencing this problem? Do you know what I mean? So if you want to use the present continuous tense that starts with the main verb, auxiliary verb and then verb plus ing, that is also fine. I'm happy with that. So you have to speak grammatically correct and complete sentences. That is what I would like to tell you. Okay. And then you said, have you checked your vitamin D and calcium level? That is wrong. It's not levels, because there are two things, isn't it? So you can't use this. This is wrong. You should have said what? Have you checked your vitamin D and calcium levels? Okay. This is important.
Yes.
Okay. So it's a plural noun because you're asking two different things. Okay. Right. The next one is, okay, the way you have asked the patients questions was excellent. I'm very happy with the way that you were trying to ask the questions and get the information from the patient. It was so amazing. Okay, so that's a good thing. And then you said it is a age related condition. It is a age related condition. This is what you have told. That's wrong. It is an age related condition. Okay, you should say it is an age related condition. Okay, that's the correct way. All right. All right. The next one is patient can develop. All right. You said the patient can develop. It's not patient. You should say the patient can develop. All right. That's the correct way. And then you said, give me 1 moment. So the connectivity was good. Background. Okay. This time you have committed less background noises and false starts. Okay. Sorry. False starts. Okay, I'm very happy with the way that you have been improving, so that's good. Still there are a couple of things. Okay, still there are some false starts. I'll tell you what you have committed here. You have said within a few hours or so. Okay, this is wrong. This is a false start. Okay, false starts need to be avoided. All right, and then you said the chances of getting something, okay, But before then, there is another mistake. Okay, you said one of the safest test. That's what you said. But that's actually one of the safest tests. Okay, tests. All right, should be a plural noun. Okay, the next one is completely very. The chance is completely very less. Okay, so this is wrong. You should use either it is completely nil, or you can say it's very less, or it's less. Okay, that could have been done. All right, but apart from that, it is not that bad. Okay, use either very less. Okay, so the chances of getting infection is very less. The chance of getting infection is very less. But apart from that, it was good. Your pronunciation was good. I'm very happy with that. Apart from those false starts and background noises, so your pronunciation is up to the mark, and almost all the other parameters are really good enough. Okay, only grammar is not that good, and sometimes false starts and background noises. However, their frequency has been dramatically reduced, so I'm very happy with that. Okay, let me give you the expected score. All right, to me this one sounds like 350 out of 500. Great role play. Well done. You have done a good job. I'm very happy with your performance.
Thank you.